Good afternoon, Dr. Nishant
I
Sinha.
hope I am being heard. Am I audible to you all?
Yes, you
I
are.
can't hear you.
Okay.
Yes, sir.
Can you nod and say I am audible? Do like this. Anybody can nod and say yes. That means I am not audible. Nobody is nodding.
Yes, sir.
Is it? Am I audible?
Yes.
Okay. So let's
Yes,
start.
sir, audible.
Yes, sir.
Yes, sir, audible.
See, this topic is a very vast topic. It is just like an ocean, you know. So what I've thought is I'll talk only few points, but this is going to create an impact on you. You will take it home. Okay. So just starting it. Yeah, I'm Dr. Nishant Sinha. I'm a senior consultant pulmonologist at Continental Hospital. We have been managing COVID very actively for the last 3 months. In fact, when it started, we were in the front line always, and we prepared the guidelines for our hospital. I was in the drafting committee also. Show the presentation. What is that? It just got closed. So basically, the few questions which I would like to answer here today is what I have just prepared. Very short presentation.
Can we request everybody to go on mute, please? Hiten, can you please mute everybody except Dr. Nishant Sinha?
There's some all right now. Make it full screen.
Yeah, we are good to go, Dr. Nishant.
Put here. Yeah. Okay. Can you go down? Yeah. So what I'm going to talk is I have divided my topic into 4 questions. First is social distancing. What is the importance of social distancing post lockdown? I'm sure before lockdown, what we understood about social distancing was different. What is Mohammed Karim? That's my order. Okay. Before lockdown, what you knew about social distancing was different from what you know it now. When it was lockdown, it was complete lockdown. Nobody knew who is where. Everybody was quietly hiding in their home. But now, when people are coming out, it is not like that. It is very different now. But what is happening now? People are not understanding that they still need to maintain some discipline in the social distancing. So what is this social distancing? It is basically, it is not a medicine. It is not a drug. It is just a non-pharmaceutical intervention. By pharmaceutical, I mean not drug. It's not a drug to prevent infection, but it is a way to avoid or decrease contact between those who were infected with the disease causing the organism like COVID-19 and those who are not. So as all of you know, this COVID-19 disease is caused by a virus called coronavirus. There are 7 types of coronaviruses. 4 are the normal ones which cause common cold. And the 3 are the ones which are bad. Number 1 is MERS, number 2 is SARS, and number 3 is this one, which is like SARS, but it is SARS-CoV-2. Different, almost 80% similar to SARS, but it's a new one. That's why it's called novel coronavirus. So social distancing will definitely have impact to reduce the spread of infection. This is called blast from the past. If you learn from the past, see this in this picture. This is from US, 1918 flu pandemic. Okay, there are 2 states. One is Philadelphia, other is St. Louis. They are around 900 miles apart. If you see this picture very carefully, in Philadelphia, the first case of flu was found on first case was found on September 17th. They took it very lightly and they didn't do anything. And by October 3rd only, when a lot of complaints happened, they started doing social distancing interventions. But still, because of that lag,
that lag of 18 or 20 days, you can see the peak, how the number of cases increased. That is 250 deaths per 1 lakh people. But at same time, if you see St. Louis, in St. Louis, the first case was found on October 5th, 1918. Within 2 days, they learned that, okay, we should start doing lockdown, start doing social distancing. And you see how the number of cases have reduced. This is very important for you to observe. This is called flattening of the pandemic curve. You might have heard all this, but I want to show you blast from the past, because the past is one thing which never leaves us. So we need to learn it. If you see this pandemic, somewhere here will be your healthcare utilization full. If I take it as 150 deaths per 1 lakh people, I mean all the ICU beds in the all hospitals will be full. Okay, if you assume that. So here in Philadelphia, it has crossed that, and that's why people have died badly. But in St. Louis, they have reduced that, and that's how social distancing has worked. So this is a slide to show that it has got importance. It is not just people are saying, but it has got meaning. We have crossed this stage because our lockdown is over, but now we are in the open phase. We need to still maintain social distancing, because if you do that, you will flatten the curve. This is another very simple slide. It's not difficult. If you see, this was from Wuhan, somewhere in the 3rd week of January. If you see this, Hubei went for lockdown on 23rd January, and it took almost 8 weeks for the cases to decline. Now, if you ask me, if you do lockdown today, how many days it takes for cases to come down? It takes around 6 to 8 weeks, for cases to start coming down. So if you say in Hubei, they started lockdown on 23rd January. From 14th February, cases started coming down, and see how it happened. So less cases. So that's what is important. But you compare this with, okay, so I'll just say, so remember these 4 features. The success is do more testing, isolate the infected, and quarantine the contacts. Isolation means separating people who are positive for COVID-19. Quarantine is who are still not having positive result, but they are suspect. Once you do test on them, they're positive, and you do maneuver called isolation. But till you have not confirmed positive state, you do quarantine. That's the difference of these 2 words, quarantine and isolation. Now it's this picture, very, very nice. This is called social distancing. If you see this policeman, he is having corona on his head. He is having corona on his stick. But see this lady, how nicely she is sitting. She is wearing something like mask here, and see the distance. It is almost more than 2 meters or whatever, 2 feet. So corona is not going to enter her, So what is important here is, without social distancing, one single person can infect 406 persons in 30 days. This has been studied, researched, and that's what I'm telling you. In 1 month, if suppose one person is infected, he goes all around, doesn't maintain social distancing, he can infect 406 persons. You can imagine India is not a very literate country. People are illiterate, going on the streets, doing this, doing that. That is why it's important you take care of yourself. You wear mask, you have home sanitizer, you have keep sanitizer with you. Don't go out if it is not required. But the same person, if you do social distancing, he can hardly infect 2 people. That is why it is important. This is just another math behind social distancing. I just show these slides because I like it. See, if you see this in the first, there's something called R naught. R naught is nothing, very simple thing. R naught means how many persons a single infected person with COVID-19 will infect. So R naught for COVID-19 is around 2 to 3. I'll say 2. That means one person will definitely infect another person in a short time if you don't do social distancing. And that is why 6 feet is what is important. If you see this math, suppose this first person is infected, okay? They didn't do social distancing. In 5 days, he'll infect around 2 people. The research says 2.5 people, but I'll just keep it 2 people. But in 30 days, he'll infect 406 people, which I've already said. But if you take social distancing or lockdown by 50%, that means you cut down the movements by 50%. then he can hardly infect 1% in 5 days, and he can hardly infect 15 persons in 30 days. But if you do this more strictly, you do by 75%, he cannot infect even a single person in 5 days, and in 30 days he'll hardly infect 2.5 or 2 persons. That is the importance of social distancing. This is the maths. So suppose somebody is illiterate, he's going on doing this, that, but if you are careful, you will not get it. That is why what I'm seeing nowadays, when the grocery shops, everything opened, people are just going and shopping, buying things. But I'm seeing patients coming back to our hospitals getting admitted. When I ask them, what did you do? He will say, I had gone to this mall, that mall, this shop, that shop, Let's go to. Yeah, good. So I have told you about R naught. No, this is 6 feet. See, what is important in this picture is COVID-19 doesn't spread by airborne. Airborne means something which is just in the air and is going. It is mainly spread by a droplet. That means when you're speaking, when you're coughing, when you're talking, the droplets will come out from you and it will go to some other person to infect. It can also spread by fomites. Fomites means the same droplet will drop on the objects like gate, table, chair, and when some other person will touch it, he'll get. If you see this picture very, very carefully, these are the droplets. The size of droplets are more than 5 microns. These are the droplets. See, if it is 6 feet, they won't come from here to here. They'll fall down. Okay, they'll fall down. So, but if this person comes more nearer, this droplet will go in him. That is why it is told for 6 feet. Research has been done, and this is what it is said. So maintain 6 feet distance. So I've already told that how do you prevent it? So you maintain physical distancing, at least 1 meter closure, but that means keep yourself aloof as much as possible, do what is required, try to follow online mode of payments. But people like me, police, and there are a lot of other people, they can't sit at home, right? I have to come out, we have to work. So there are some subset of people who have to come out, but they should take good care of themselves. If they take good care of themselves, they can take good care of the family. Otherwise, if they keep falling sick, everybody in the family will become sick. Nowadays, we are seeing cases, whole families coming, with COVID-19 positivity. So we are tackling them. But the message is out and right. Try to avoid it. Maintain social distancing. Use hand washing techniques. I'm sure all of you know. Use sanitizers. Now, this is another picture. This is post-lockdown. This is new normal. This is not from India. If you see this picture, you see this lady. She's trying to buy a juice from this. This is from UK, one of the centers. So if you see this lady is trying to buy a juice. Look at how this is being done post-lockdown. This is what the current state of affairs. He's keeping the juice this side. She's having a mask. She'll put her hand down, get it out. He'll take his hand back. This is called social distancing. But have you imagined how it is happening in India at present? I'll show you. This is a picture of one of the flights. The flight has just landed. People have everything. They're having headgear, they're having gloves, they're having masks. But look at it, how they're doing. They all want to come out immediately. I'm sure you must be remembering this in your mind even before this lockdown started. But now it is more important to act on it more carefully. They have face shield, they have sanitizers, they did web check-ins, but they didn't have common sense because they're not all following social distancing. If they could have just sat on the chair, whatever their seat, and they could have come one by one. What is the need of just sitting, making a overcrowded that queue? And I'm sure the crew managers would be saying, please be seated, please. But see, they have no patience. In this problem, they might be causing droplet infection, even though they have masks. But how much mask will protect? See, they are so near to each other. So these masks can protect you only by 80%. 20% still there's a risk that you will get. And if you are this near, you are sweating, you are still coughing there, you may get. So my message here is please avoid these things whenever you are going out. So post-lockdown, social distancing in India, it is more difficult for us. It's not easy. When we were in the lockdown in the home, all of us were hiding. There was no problem. But now when we are coming out, some people have got false understanding that everything is all right, nothing will happen to me. And so they are doing all this. No, hand hygiene is, see, I'm having a sanitizer, I'm doing this. So hand hygiene is very important because it is everything from hand. From hand it goes to nose, eyes, mouth, and then it goes to the lungs. Try to avoid going to crowded places. Don't take things casually. Now, one step ahead, home isolation, home quarantine. A lot of people have asked me about this. We are doing it very actively now. If I have a COVID positive patient who is just mildly symptomatic, I don't admit him. I just say him, please go home, take care of yourself, and we'll also take care of you. So what we do video consultation. After every 3 days or 5 days, we talk to them and ask them how they are. So as I said before, isolation means separating a confirmed positive case from the community, and quarantine means separating a suspected case from the community. Both these words are different. Don't interchange them. When you have a positive case, call it isolation. When you have a suspected case, call it quarantine. Simple. Now, there are some instructions, for the caregivers. It is a very vast topic, but I'll just brief on it. When we send a patient home, when a patient is there, patient always has caregivers like patient's father, mother, or son, daughter-in-law. So we always teach them what to do. So we teach about mask. So the caregiver should always wear a triple layer mask and change the mask every 8 hourly. Then the caregiver should have hand hygiene, frequently wash his hands. I can send you this thing in writing to you, but I just want to read it. The caregiver should try to prevent as much personal contact with the actual patient. If the person is giving some food, he can leave it at the door of the patient. Patient can be inside the room. He need not come out. Otherwise, he will infect and there is cross contamination. Avoid direct contact with whatever things from the patient, like avoid any disposable gloving while handling the patient, perform hand hygiene properly, always use triple layer surgical mask, But there are some instructions for the patient also. Patient should at all the times use mask. Patient should always have triple layer mask and discard his own mask after 8 hours of use, or earlier if the mask becomes wet. Mask should be discarded after disinfecting with 1% sodium chloride. You can get that in the market, sodium hypochlorite. Patients must stay in identified room and away from other people in the home, especially elderlies and those with other conditions like diabetes, hypertension, kidney disease, etc. That means somebody who is COVID positive, suppose there is a young patient who is COVID positive, and there are other people like parents are there. So this man should be always inside his room. Don't take it casually. I know when he may be just thirsty, he'll just come out and take water from the fridge. Please avoid that. He has to be inside. Through some instructions, he can contact people outside. These people can give things at his door. He can come and collect. Patient must take rest and drink lots of water. It's very important. Don't share personal items with other people. Clean surfaces in the room that are touched often, like tabletop, doorknobs, handles, with 1% sodium hypochlorite, or you can also use this. Any sanitizer will work. The patient must strictly follow physician's instructions. I'm sure they do that, and they should monitor their health properly. And if they're in doubt, they can come to hospital. Nowadays, we are following the home quarantine or isolation for 17 days. Suppose I have a patient who came today, mild symptom and COVID positive, and I feel he doesn't need hospitalization. I can very confidently send him to home. In fact, today also, I have done a lot of video counseling for people who are in home. They're old people, they have diabetes, but they're doing quite well. So what I do, I just give them courage. I just tell them, you are doing fine. You don't need to come to hospital. Just be in home. Again, contact me after 3 days. So after 3 days, I make sure I see them on the video. I tell them to walk in front of me. And if they look very fine, no breathlessness, no difficulty in breathing, I'm very happy, and we continue that. So this is what we are doing now. We don't admit all the patients. We encourage them to go home as much as possible. So already I've told this. Now coming to this topic, treatment of COVID. I think some of you might be interested, some of you don't want to know, because you will think, what is this, so confusing. So there has been a lot of confusion going around, but yes, we have treated our patients very well, and people have done very well. They have gone home, even from ICU. People who are on ventilator, we have pulled them out with medicines. So I won't say this is futile, and I won't say this is hopeless situation at present. We have medicine, and they are working. So this is one slide. I'm sure you can see it. In the left corner, there is a bridge. There's a flyover with full of traffic. There's a bus. There's a three-wheeler. People walking. This was our situation in the month of January. We had no resources for COVID-19. We were struggling. We were trying to do some research quickly, get a medicine. There were too many cases everywhere in China. Slowly cases started increasing in US. India also added. By March, we were like this. But I will say today we are somewhere here. We're a little better. And these are my drugs. See the same flyover. This is from Hyderabad, one of the flyovers. This is a front vehicle which is going at a very high speed, and this is one of the drugs called remdesivir. This drug has got the highest evidence. It works. In fact, I am also giving it now. We have very much difficulty to get it, but when I write request, I get it. Then I give it, and I have pulled out my patients from ICU with this. This is remdesivir. After that, this is the next drug. This is called lopinavir, ritonavir, hydroxychloroquine. Then you have something called favipiravir, new drugs. They're all after that, third, fourth, like that. After that, you have convalescent plasma. This one is here. Then you have azithromycin, like that. There's one drug which is going the other direction. That means if you give it, patient will not improve. So these were some of the drugs which used to be given earlier, but now it is stopped. We don't give it anymore. And there is something here. You can see some big vehicle coming. It is hidden by this flyover. This is ongoing research, which we'll come to know in the next few weeks or months, whatever. So I have just left it. I don't know what it is, but it will come. And what is this then? You're seeing a flight. A flight is taking off, and there's a fence there. Can you guess what this could be? Can you interact with me? Can't interact? What is this? Can't interact. Okay, forget. I'll tell you what is this. I'm sure you might have thought of this. Vaccine. This is vaccine. This is coming in making. Vaccine means it is going at a very high speed, and we'll get it soon. Why I put this flight as vaccine? Because normally, in a normal time, it takes around 10 years to have a vaccine for any disease. But now, it is going at a very fast rate. I'll show you that. So I'm just summarizing my treatment options. You see this, you can treat coronavirus by repurposing earlier drugs. That means these medicines were for some other use. You have repurposed them for COVID-19. Like there was some virus called Ebola. So remdesivir worked for that. You took remdesivir, used it for corona, it works. HIV medicine like lopinavir, ritonavir, you are using it and it's working. Malaria, hydroxychloroquine. So you are trying to use those drugs which were used for some other thing for COVID-19. The other way of treatment is through antibodies. Antibodies means antibodies are weapons. When I get infection, I develop antibody in my body and I kill the infection. So you can generate antibody in mouse. You infect the mouse with coronavirus, mouse will produce antibody, take it out and give it. This is very difficult to do it, not easy. And third thing is vaccine. So vaccine is in making. So as I said, vaccine takes generally 10 years, but now vaccine is going at a pandemic speed. So this is, I'll just skip this slide. Skip all this. Yeah. So just I'm trying to summarize. This is just a slide to show how the drugs work. I'm sure you won't understand this. So move. But this is a slide to show which are the drugs which we have. I told you in that flyover, the drugs we are going. Remdesivir is the highest one. We have hydroxychloroquine, which has got low evidence, but it works. We have lopinavir, ritonavir. We have something called tocilizumab. We have favipiravir. We have methylprednisolone. We have plasma. Plasma means you take the blood of a person who got infected, separate the white blood, and give it to the patient. It has worked and it works really well. I have used all these modalities in my practice here, and it works very well. A lot of our patients have improved and they have gone home. This is an example of one of my patients with whom I treated with hydroxychloroquine. You see in the right lung, there is a shadow here, it's a pneumonia. This patient was persistently positive for COVID for almost 26 days. So I then did a CT scan, found this pneumonia, started her on hydroxychloroquine, and if you see in the repeat scan, it has gone, it has cleared, it's not there. So this shows that hydroxychloroquine worked. This is the pre-scan, this is the post-scan. So next question is, why is vaccine taking so long? What is the reason for that? Why not we are having vaccine today? So see, any vaccine to produce, it goes through preclinical phase and then it comes in the clinical phase. Preclinical phase means vaccine is developed in the lab before testing and it is tested on animals. Once it is found to be safe on animals, it comes in the clinical phase. Clinical phase has got 1, 2, 3, 3 stages. Phase 1, phase 2, phase 3. You might have heard this, phase 1, phase 2, phase 3. Phase 1 is done on small group of healthy people to check safety of the vaccine. And phase 2 and 3 is for to check whether vaccine is really working or not. Okay. So what is happening is, generally when one phase is over, we go in the next phase. But at present, we are not like that. We are doing phase 1, phase 2, phase 3 all together so that we can get quickly, And as we are passing from one phase to other, there is a capacity building. Like factories are producing vaccine on large scale, and there is something called regulatory agencies which judge and license the vaccine. So the thing which takes more than 10 years is going at a pandemic speed now. It's going at a very fast speed. If you see the share of vaccine in world, 18% from China, 46% from North America, 18% from Europe, and 18% from Asia and Australia. So this is what all these continents are working behind, and hopefully it will come. So this is just a picture showing same thing, how we are shifting from long period to short period. So phase 1, phase 2A, phase 3, and then licensing. So we are clubbing all this and producing vaccine on large scale, and that is why it is called pandemic paradigm. It means vaccine is being produced at a pandemic speed. These are just vaccines which are in the picture now. So China, I just put 4. China has this, USA has this, UK has this, India. We are started producing large scale on this vaccine called Chadox 1 from Serum Institute. It should be ready by the month of, I think, October, November. They are claiming already research is going on. But among all these, I think China is going at a very high speed. They are not sharing their data. We don't know much. But maybe China or UK, one of them will get it by this year end or next year January. Once we have the vaccine, things will be better. We'll be more happy and we'll be more confident. So coming to ICU management, I won't waste your time on this. This is what we do when the patient is sick. We take care of them and we make them better. I'll just say in short, we have different strategies to treat patients who are sick and who have landed in the ICU, but we take care of them. Now, what is healthy lifestyle during lockdown? I have read a lot of articles. People started drinking more during lockdown, because they had nothing to do. They drank. So if you see this, to avoid that, you need to practice mindfulness. Mindfulness is going to reduce your stress and anxiety. It can also help you in your concentration. It can improve your memory. So what is mindfulness? This is how you might have seen all this. You must be doing also. So deep breathing for 4 to 7 to 8, 4-7-8 approach we call it. Take deep breath for 4 seconds, then hold it for 7 seconds, then exhale like that. So repeat cycles. This really helps a lot and keeps yourself cool and calm. So other ways to keeping yourself healthy is stay in touch with family, friends. Don't make yourself aloof, otherwise you'll get depressed. Get enough sleep, do yoga, maintain healthy balanced diet. Don't eat too much of fried items, and avoid alcohol. There was a study in UK. They found that 21% of people who were alcoholic were drinking almost twice during the lockdown. And next thing is keep hydrated. I'm sure you drink lots of water, so keep that habit going on. That anyway, it's not the peak of summer, but keep yourself hydrated. And people who have the habit of drinking, I'll suggest, don't just go on drinking, cut it down. That's all. Thank you.
Thank you so much, Dr. Sinha. Can you hear us, Dr. Sinha? Okay, Dr. Sinha, they will be disconnecting and connecting back because they have a sound problem. Now I open this session for Q&A. All the questions that you have, you may please use the chat box to put in your questions and we'll answer them. We'll try to take as many questions as possible and get them answered by Dr. Sinha.
Samina madam, can you? Hello, can you hear
We
our?
can hear you. Can you hear us, Karim?
Yes, yes, we can hear you, ma'am.
Wonderful.
Yeah, you can.
Thank you so much, Dr. Sinha. On the onset, I would like to thank you so much for being a part of this session and giving all these valuable insights on COVID-19. I'm sure it will help us manage things better in these unprecedented times. Thank you so much for all that insight. We have a lot of questions coming in, Dr. Sinha. I'll appreciate if you can help us and handhold people around with those answers. So I'll begin with the first questions. We'll try to take as many possible in the limited time that we have here right now. The first question is, how important is boosting immunity in this current scenario? And what is it that we need to do to boost our immunity levels during COVID?
See, these are all it's just like somebody said, then next somebody said, and they kept on saying, you know.
Okay.
These are all big terms, immunity boost and all. See, there's nothing called immunity booster. You can continue doing your regular work, regular food practices, and do whatever is said. Like there are very less evidence that these things increase immunity. Like zinc is there, vitamin C is there. Somebody is saying garlic is there. So I think there is no harm in refusing them because they are not causing any harm to us. So it is better to take them. But there is no guarantee that this will protect you from COVID-19. I have had patients who were taking all these booster immunities for 2 months. One patient came, he's saying, I've been taking zinc, garlic, ginger daily, and he came with COVID-19. So whatever you're doing before this COVID, and if you're strong, you're a normal person, it's fine, you know. So there's nothing in this world which can make you immediately in a short time something like so strong that no virus can attack you. But doing normal things like doing yoga, doing regular exercise, avoiding alcohol definitely will boost up the immunity. This much I can say. So people who are drinking, please cut it down and start having healthy lifestyle. But at the same time, you can take all these like vitamin C, zinc, vitamin D, and whatever you can also suggest, garlic, ginger, all those things. It has some indirect evidence, but there's no harm in taking them.
Yeah. So you're saying that a balanced diet, a healthy lifestyle, and a mindful eating is what we need to do.
Yeah, exercise is important. Yeah.
Yeah. Okay. Thank you, doctor. And I was so glad to hear from you when you said that minor cases of COVID can be actually quarantined at home without we being panicked. We should not rush to the hospital, but look at managing it at home itself.
We are doing it very beautifully, ma'am. We have such a nice program here now that when the patient comes to emergency, they call me. The first thing I ask is, how is the patient? What's the breathing rate? What's the saturation? There are two things I ask. If breathing rate is normal, saturation is fine. We just tell them go home and we'll talk to you again in 3 days. We do a video consultation. I see the patient and I make the patient walk in front of me 5 times, 10 times. Then I recheck his oxygen levels. And if everything is fine, I just say be at home. You're fine.
All right. I have this question, doctor, with that same perspective. We're saying that mild symptoms of COVID, then we need not go to hospital. The very first question there is, how do we identify that these are the symptoms of COVID and they are mild, and then decide that it can be quarantined at home as well? So that's a fundamental question. How do we know what symptoms should we look for and whether they are mild or to what intensity it is? How do we judge that?
Just a minute, I'll call you back.
Yeah.
Hello? Yes, hi, sir.
Yeah. So most of you might be resonate with the question that I have just asked Dr. Sinha, because it is important for us to understand what exactly are the symptoms and what is the intensity of these symptoms that can be quarantined at home, and when is it then we should think of going to a hospital. So let's get that answered from Dr. Sinha. That's a very critical question that we all need to understand. So once he's off his phone, he'll answer that for us. In the meanwhile, if you have anything important other than this, you can please use your chat bot and keep adding to the questions. We'll try to get them addressed as well from Dr. Sinha.
Hello?
Yeah, thank you, Doc.
Can you
Do
hear
you
me
want
now?
me to repeat the question, Dr. Sinha?
Hello? Yeah, hello?
Yeah, do you want me to repeat that question, Dr.
Yes.
Sinha?
Sorry, I got a call from ICU. Just I managed on phone itself. I'll
No.
tell you. Go ahead. What is the question?
Yeah, I'll repeat the question. I was saying that you had said that we can do the home quarantine, right? If we find the COVID symptoms are mild. But the fundamental question there is, first of all, how should we identify that these are COVID symptoms and at what intensity they are, whether they are mild or high? How do we judge that?
Okay. See, the first thing is in your question, the first thing is you see the age. If somebody who is more than 60 and who has got underlying conditions like diabetes, high blood pressure, you have to have extra, suspicion and extra eye on them. I'm not worried about somebody who's 35 or 40 and below 50 year and just normal life, but I'm more worried about people who are more old.
Okay.
So symptoms will be fever, the first symptom, temperature more than 100 degree Fahrenheit. Okay, number one. Number two, any loss of smell. Nowadays, we are seeing a lot of people coming with the loss of smell. Suddenly they'll say, I can't smell. My smell has gone, or any loss of taste. Okay. Number three, any cough. Any cough, any dry cough which is not going for more than at least for 3 days. Persistent cough, and any difficulty in breathing, even mild. Like suppose you're fine to do your routine work, and now you're feeling little heavy that you can't do it. You're feeling little breathless. Some people are anxious also. Bearing apart that, little breathless also. And if you have this age group with these risk factors, please test yourself. Don't leave it.
Okay. All right. Thank you so much, doctor. And is there a procedure to do it for home quarantines? You already said the isolation is required. And what else should be done, doctor?
Yeah, there's a nice guidelines I can send across to you. I was reading that. There's a nice guidelines put forward by government, and we have also modified it. So it's a one-page leaflet, do's and don'ts, what we tell to our patients. We can do that. But what I'll suggest is don't take all the responsibility on yourself. Share it. Suppose you had mild symptoms, don't assume this is COVID, and don't just start isolating yourself. Meet a healthcare personnel once. Just talk to them, show them once, and then after that take it forward. Because what is happening is people who are old, suppose if they really had COVID and they didn't meet any doctor or any healthcare facility, and they just kept them in the house, suddenly it will deteriorate and they'll be confused what to do now. So we always keep our patient in follow-up.
So the need of the hour is to be very cautious and keep an eye on any symptoms that you see and take immediate action, right?
Yeah, that nowadays what I'm seeing, I'm telling from experience, we have had people who is just saying, I'm only in the home, sir. How did I get it? Then when we took more history, then we found that the old man is in the home. He's 65, 67, whatever. But he has 3 or 4 sons who are all working now. One works in IT firm, one works in some business. They have been going in, coming out, and they were strong because they were young. But because he came in contact with them in the house, he got it and they were still safe. They still have no symptom, but he has no fever. So what we are trying to suggest is, if there's an old person in your house, please take more care of them. Don't just touch them like that. Wash your hand, wash your, use sanitizers, or try to avoid touching them. Just meet them, just be casual.
Yeah. Okay. That's a very valuable point, Doctor, because we'll have a lot of us will have parents and in-laws at home who are that age. So definitely we
Yeah,
keep
nowadays we are
that.
seeing more patients of that age group. And when we ask them, sir, you didn't go out, how it happened? So they keep saying, I'm always in the lockdown from 2.5 months. I'm in the house, I've never gone out. But when the son comes, we ask him where all he work. Then he says, I've been roaming around with for my work everywhere. In the end, I come to home and we eat in the same table. So it has happened in the home, you know.
Yeah,
This is called
unmindfully we do all
community
of that.
transmission.
Yeah. I'm moving on to the next question from a participant, Doctor. This is from Suresh Naini. He says, when do we use ventilation in corona cases? And what is the ideal time to treat patients from corona problems?
You ventilate the patient only when it is required. There are set criteria, you know. We have like, it's like tick box, like maths. So you don't have to worry about that. That is our worry. We'll worry about that. When to vent? It's a difficult question, but if the patient needs ventilation, like his oxygen requirement has gone very high, he's not breathing on his own, then we have to put him on ventilator. But by and large, we try our best to keep the patient best without ventilator, right? So, and you next question, next part was how do you treat, right? What was the next part?
He's saying ideal time to treat patients from corona.
Very good question. So see, this is a nice question. So ideal, see what happens is corona has got 3 phases, you know. I'll explain in a very simple word. When you get infected with the virus, okay, the virus starts manifesting its symptoms in 4 to 14 days, okay. So once you develop your symptom in this time frame, in the first week you have something called viral phase. That means in this first week you will have mild fever, body ache, loss of smell, loss of taste, some cough, some difficulty in breathing. That's called viral phase. If you meet a doctor in this phase and doctor does the test and he confirms corona, in the viral phase, suppose you don't have any difficulty in breathing, your oxygen levels are good, then doctor may not even treat you, just wait. Just wait and just watch you. But suppose in the viral phase, if your oxygen levels are down, then it is called pulmonary phase. You're a little more down. It is called pulmonary phase with oxygen requirement. So when you have that phase, it is a definite indication to treat. Look, like what does this mean to me? My patient will come to me in the 5th day, and when he's just very comfortable. He's saying I'm fine, but when I check his oxygen level, I'm seeing oxygen level is just below 90%, and he's comfortable. That means I have to treat this patient aggressively to pull him out. If I leave him, he'll go down. So this is the time I should treat. Now some patients come little more later. They'll be in the home. They'll just say, "Oh, I'm fine, I'm fine." But suppose they had come after 10 days. And when he comes to us, he's more breathless. When you do blood tests, we find that everything is, haphazard. That is called inflammatory phase, when the body's immune system is only fighting with the virus and having a lot of immune reactions. That is the most sick patient, and we need to use all our resources to treat him. We give steroids, a lot of new drugs have come, But in between these two, like somebody who has viral phase with lung pneumonia phase, with some oxygen requirement, there's a drug called remdesivir, which is just brand new drug, which is just launched in India. It works very well. So in fact, I have given to a few of my patients, and those patients could avoid ventilator, they didn't go on the ventilator. You just gave them the right time and cured them and sent them home. So that's how we decide to treat the patient.
Okay. The next question we have, sir, is about the symptoms which you have already addressed. So I'll skip that question. There's another question from Sangeeta. She's asking, is there any definitive time when we can get the vaccination?
Yeah, I told you. So see, all this China is very quiet. He's not telling us when they will, but I have read a lot of things. China's research is going the highest speed. So, and they started the research earliest, for vaccine. So I think their vaccine will hit India market, the market by January at the most. But UK is claiming that in their subgroup of patients whom they tested, it has shown very good results. So they are claiming by October, So something we should have by October.
I'm just extending this question by asking, doctor, that we've heard there is vaccination coming in by Hetero Pharma. There was news just the other day that they are introducing some vaccination in the form of a... Is that correct?
No chance. That's not vaccine. That's remdesivir. That's the drug I'm talking about.
Okay.
Remdesivir is a horse. Horse, the white horse. Yeah. It's a white horse for corona.
Okay. So it's not a vaccine per se.
No. Hetero Pharma has brought that. It is very difficult to get it In fact, I'm having headache to get the drug. We have been writing to the Drug Control of India, to the hetero chief, and after a lot of difficulty, we get it. It's not vaccine, it's a drug. So it's an injection. It's
I
called
see.
remdesivir.
I see, doctor. Thank you so much on that. There's a question from Ram Kulkarni. He says that we have heard that COVID-19 will reoccur even though patient has been treated or recovered.
No, I have not heard like that.
Is that correct, doctor?
I have not heard. Please ask him what is his source, from where he heard.
Yeah. Ramu, can you unmute yourself and want to extend this question? But I think instead of doing that, I think we have the answer from the expert. So I guess that's not correct.
No,
So
it's a
let's
very
move
tricky
on.
question. Actually, we don't know. I have not heard. In fact, I have also worked on it. Generally, what I'll tell you now in the simple words, see, there are 7 types of coronavirus. Okay. Now, the usual 4 coronavirus which you used to have earlier, no, common cold, correct? So if you have any of those common cold virus which you got infected, you could always get new infection from another virus, from the 3. So saying that this COVID-19 is totally new virus, it's not like them. Okay. But whatever research says, as of now, as of till today, even from America, they have not come to a conclusion about this. So whenever I get this question, I tell them that it is not possible because already patient has developed immunity and this is a unique virus, unique. So he'll have this immunity in him and he will protect from himself. In fact, I have not seen any patient whom we treated and discharged and they came back with severe illness. Till now, I've not seen. We have treated more than 300 patients here.
That's a wonderful news, a little reassuring, Dr. Sinha. There's one very valid question coming in from Yogesh Kumar. He's saying, and this, I think this will resonate with a lot of people here. Any differentiating system vis-a-vis of corona, vis-a-vis common flu symptoms? I mean, people get confused with the symptoms of common flu and corona?
Very good, very good. I like that question.
Yeah.
So again, I have done this research on this. Corona has got little more unique symptoms than flu, you know, like loss of smell, loss of taste, you know, high fever higher than flu. See, flu generally used to have 99, 100, you know, but we have seen people with corona, just temperature, you know, nothing else, just high fever, not even cough. And you do the CT scan, lung is full of pneumonia and patient has no cough, but temperature is 103, 104 like that. Flu was never like this, you know. Other than that, this swine flu, you know, swine flu which you called, swine flu affected more of younger people. If you see the pandemic of swine flu, but
Yeah.
corona affects more of older people and kills them. So this is how we differentiate. Younger people were killed by the swine flu more, but corona kills more of elder people. So actually in the real words, corona is not behaving like the actual pandemic. See, if you take any pandemic in the world, in the history, all pandemic cause more death of younger population. I hope you agree with me. If you take smallpox, anything, smallpox, if you take even swine flu, they're killing more of young people. But if you see COVID-19, it is killing more of old people. So there is something which we still don't know why it is happening. But by definition, COVID-19 is not behaving like the actual pandemic in the past. It's totally new thing, you know. So this is how we differentiate. Old people presenting more with sick illness and having all these unique symptoms like loss of smell, high fever, disproportionate, you know, CT scan is showing very bad, you know, and patient just normal like that. So there we differentiate them. But anyway, we
Are
do.
rashes also a symptom, Dr. Sinha?
Yeah, rash, bluish discussion of your toenails. These all are reported, you know, because COVID causes, you know, clot in your arteries, clotting. So when the clotting happens, the leg becomes more blue. These are not found in common cold.
Common flu at all. Absolutely, absolutely.
Not all.
There's another very good question coming from that will resonate very strongly from the working population, Dr. Sinha. The very fundamental question. I mean, can we step outside for doing our work by maintaining social distancing? Is that safe at all?
Sure, you can. In fact, I could have put a slide. I forgot that. I had 2-3 slides of myths and facts. So one of the myths is when I'm going out for jogging in a park, am I safe when somebody is passing near me? So I'll tell you the logic of it. See, COVID-19, this virus, now you might have seen that cartoon, that round thing like a ball, you know,
Yeah.
with spikes, you know. So this virus needs something which is not moving to stick. Okay. If you are moving or if you are jogging, it will never stick to your clothes. It will fall down. But if you are just sitting at one place, it can sit there and get stuck. So I used to say at the end of the day, you can dance and go home.
That's
Fall
wonderful.
down in the office and then you can let them fumigate. So this is one of the things, like in our office, in our work, I wear scrub. You can see my blue scrub. This is not
Okay.
what I wear. I'll change it at the end of the day, and wear my own dress and go home. Once I go home, I take bath immediately. So so long you are moving, running, it won't stick there. But once you are sitting quietly and somebody is coughing on you, it will come and stick there and it will stay there. So your question was if you're going to office. So I think you can still have social distancing, 1 meter sitting arrangements, have sanitizers, frequently wash your hand, and best thing is at the end of the work session you can have bath in the office till you come home. But if it is not possible, when you enter home, leave your footwear outside, have proper bath inside when you enter the house, and then after that you enter the home.
Wonderful. What is the role of oxygen concentrator in COVID-19? Is it recommended? How relevant
No,
is its use?
no role, no role.
No role at all.
Unless, in fact, it is more risky because oxygen can cause aerosol generation in the house. So unless it is really indicated, we would not advocate use at home. Suppose my patient has low oxygen, I won't discharge him. I'll keep him till, like I had few patients last 1 week. I waited for a few more days. Then finally she improved. Oxygen improved to 100%. Then we said, okay, now you go home. But I would be a little careful in sending them with home oxygen, because when you use oxygen and it's going in the patient's nose, there is a possibility that it can generate aerosol.
Okay, so I think that's a good one, Dr. Sinha. I will take another 2 questions in, and then we'll close, Dr. Sinha. There's one question that they're saying, we're seeing a lot of people in lot of localities in the city. In the neighborhood, we are finding some positive cases. In such instances, what are the precautions that we should take? Because we are seeing positive cases in our neighborhood. Then what do we do?
Again, I told you, COVID-19 doesn't stick to your body if you are walking, moving. Don't go to their house. That's it.
That's it. Okay.
Do your own work and be confined to yourself, and don't let them come to your house. That's it. And but see, one more thing is, don't penalize them for having COVID-19. Don't create a stigma, because just leave it. Let them be in their home. I'm sure they'll do that. But these things that will it travel by air? It is not possible. It doesn't travel by air. I showed you one slide. No, droplet 6 feet. It will fall down. It will go to the ground. So it is not spreading in the air.
There is a question from Anshul Nagrat. He's saying, I have elderly people at home who are above 70 years. They want to go for a walk in evening. What are the suggestions and guidelines? And there are a couple of COVID cases around us. Now, I have this question also, Dr. Sinha, because I also have old parents and they want to go to evening walks. But I'm a little apprehensive to take them out. So,
so for people 70-year-old, I'll say don't let them come out. Let them walk in the home in the balcony.
Okay.
But if they are really going out, put mask on them, and somebody has to accompany them to guide them. Otherwise, they may be walking and they may be sitting somewhere, they may not realize, they may forget. So you can go with them and you can walk with them and help them. Otherwise, best thing is to keep them in the home. And if they really want to go out, use surgical mask. And before going in and after coming back, they should wash their hand with soap and water for 20 seconds. And they should not touch anything outside. So see, what will happen is they will not be able to take care of this much. They'll forget. 70-year-old. The best thing is ask them not to go out, be in the balcony. Wait for some more time till herd immunity comes back. You can wait for 2 more months. I'm not saying don't let them go out indefinitely, but maybe in 3 months things will be better than what it is now. So they can wait.
Is monitoring our oxygen levels is also a good idea, Dr. Sinha?
It's a very difficult question. I don't know, because see, all people who are normal, right? Why will suddenly, if you have no symptom, why will I advocate, see, I'm also working daily. I don't monitor my oxygen. I'm fine. So unless you have this confidence in yourself that you are just doing fine, you're eating well, you're not breathless, you don't have cough, and you're just as you are to yourself, you don't need to do anything. Just keep those social distancing, follow the rules. That's it.
That's right. There's a question from Marina. She says, I have kids below 10 years. People from house go to work. Do they get infected? I think a doctor has already answered this. Old people and children both are prone to infection if they are people who are going to work.
Yeah, I'll tell you now. Some people who is wearing shoes, and there are some children who are crawling in the house, right? So please never walk inside the house with the shoes in, because you never know, it might be stuck to your shoe and you are getting into the house on the floor. please open your shoe outside, if possible socks also outside. Come inside, wash your hand, sanitize it properly, and then if possible take bath. So don't come with that shoe or whatever slippers in the house. That's very important if you have children. Otherwise, rest all thing is same rule.
Okay. Thank you so much, Dr. Sinha. We'll not hold you. I know you'll have patience to attend to. Thank you so much for giving us this time and a lot of insights. Thank you so much. I'm sure all of us this was very helpful for all of us and we got a lot of insights. Thank you once again.
Take care. Bye.
Thank you everyone for being part of this session. Thank